Love our new open. Love it, love it, love it. I love John Summers on it, too. Hey, I'm smiling. How would you like your smile to shine the brightest? Well, let's say what's coming up next, your holiday photos. It can happen at the Aesthetic Associates Center, where Dr. Todd Shatkin and his staff work wonders with dentures and an implant procedure that he invented and perfected. Well, today, Dr. Shatkin is back to tell us more. And, Doctor, we were having the most interesting conversation, believe it or not, about dentures. I did not realize dentures have to be replaced every 7 or 8 years for very good reason.
Yes, for sure, Linda. It's great to be back. And, you know, I was on last week, so you may get tired of seeing me so much.
Not for this subject. I think this is great.
But I love being here. And, you know, it is an important subject because a lot of people think they can keep their dentures for 10, 15, 20, 30 years, and it's not a good idea, and for a number of reasons. Number one, there's a health issue because the dentures are made out of, the bases are made out of acrylic, and they shrink and contract and expand, and they develop porous areas, and they can develop bacteria can get into the acrylic. And when you wear those dentures in your mouth, of course, the bacteria can get into your system. It can irritate the gum tissue, and then, of course, every time you eat, you swallow your food, it can get into that. And it's not healthy to have old set of dentures that are really dingy to be wearing those at that point.
Okay, now you're going to have people say, yeah, but I soak them every night. Isn't that taking care of the bacteria?
Well, they do to some degree. And of course, cleaning the dentures is very important. You need to use a good denture brush, soak them in the proper cleansing materials. But even with that, over time, that acrylic breaks down. And not only does the acrylic break down, but from wearing them every day, your bite changes, and you grind your teeth while you're eating, and the teeth wear down. And so just like natural teeth wear down, denture teeth wear down even more quickly, and most of the denture teeth are made of acrylic or resin, and they wear down, and then your bite collapses. And all of us have seen the little old lady where her nose and her chin are this close together.
Yeah.
And that's because the teeth have worn down and the jawbone has worn down, and that needs to be reestablished to the proper vertical, because if the bite wears down so much, you get jaw problems, you get muscle problems, TMJ problems, you can develop all sorts of problems.
Wow, and you were saying that your bone changes too.
Absolutely. You get bone resorption from wearing dentures for a long time, and especially if they're not fitting well. And a lot of people out there suffer every day with their dentures flopping around, moving around. It's sore here, it's sore here. How many spouses listen to their loved ones complaining, you know, I can't eat, it hurts right here, my denture, it's rubbing on my tongue, it's digging into my gum, and it just is uncomfortable. Well,
the good news is that by visiting the Aesthetic Associates, they're just about at the point for next day dentures. This is amazing.
Yeah, we're going to implement a program to offer patients their new dentures within 24 hours.
Wow.
And it's going to be effective within about 3 or 4 weeks. And we're going to be able to get them in either in the morning or early afternoon, take all of their impressions and records, and by the next day have a finished set of dentures made, but not just, this is not an economy denture. This is a top quality, the best quality dentures available. We want to do this because we know how difficult it is for elderly people to get to offices back and forth, and it used to take 4, 5, sometimes 6 visits to the dentist to have a good set of dentures made. But we're putting a program together where, with the new technology, equipment, laboratory equipment, we're able to fabricate these very quickly.
That's
great. And affordably.
Wow. We have some phone calls. Some folks would like to talk with you this morning. Hi, you're on with Dr. Shatkin. Hi, caller, you there?
Good morning.
Yes, go ahead. I can hear you. Okay.
Good morning.
Yes, go ahead.
Yeah, I had dentures for 6 years.
Yes.
And I can't eat with them. I gag every time I put food in my mouth.
Okay, you said you gag?
Yeah.
Okay, so you have trouble with the upper denture with the palate covering the roof of your mouth, right?
Correct.
Yeah, we can make what we call, we term as a horseshoe denture, a denture without that plastic palate on the roof of the mouth. And we do those quite often, and then sometimes we'll put the mini implants in to anchor them in place, and so you can have a new denture made without the palate, and it can snap into place. The reason you use the palate is to get that suction, but with the implants you don't need the suction. You've got the implants to hold the denture in. and very often we can eliminate that palate.
Wow, good news. Good luck, everybody. And you know what? There's a free consultation if you want to go
Absolutely.
in and have the doc look at it. That's really great.
Yes, for sure. We offer free complimentary consultation. You can come in, we'll do a consultation, we'll give you an idea of what we can do
sounds
for
like
you.
you really can help her problem.
Definitely,
Yeah.
definitely. And you know what? One thing I didn't mention is with the new dentures in 24 hours, we can also do their implant procedure at that second visit. So they can come in, if they decide to have implants, we can do their dentures and their implants within 24 hours.
That's amazing. That's amazing. That's great news. Hey, we have another phone call. Somebody else standing by. Hello?
Yes, hello.
Hi.
I'm calling. I have an 8-year-old son who's missing 2 of his adult teeth on the bottom right in the center of his mouth. And they're talking about braces in the next couple of years to bring all his teeth together. I was wondering if implants would be an option with this.
Did you say he was 18?
8.
Oh, 8. Okay. Well, he's too young at this age to consider implants. However, you can plan ahead for that, and so it's important for the orthodontist to know that you're thinking about going that route, because rather than bringing everything together, sometimes they'll keep the space, have him wear a retainer with teeth on it, and then when he's 14, 15, we could go ahead and put the implants in to replace them. But depending on the individual situation, if the teeth are crowded in other areas of the mouth, it may be better to move the teeth and close the space. So every case is different. You have to. I would trust your orthodontist and what they recommend. And if you have a question, certainly, or you want to come in for a second opinion or a consultation, I'd be happy to see your son.
Yeah, because you think that if they're just looking to spread the teeth to fill in the gaps, you may want to leave him alone, like you say, preserve the space. Wait till he's old enough, then put the implant in.
Right.
It sounds like a lot less trauma.
Well, yeah, and again, it just depends on how all the other teeth are lined up, how the opposite teeth are lined up. So you have to really see the whole picture.
Yeah.
So I would get a consultation with the orthodontist, and then if you want, call me for a consultation. I'd be happy to see you.
All right. Well, I'll tell you, things to think about. Remember, dentures now, and yet the implants as well. Where can you get it done? At the Aesthetic Associates Center. Let's give you their information. They are very easily located at 2500 Kensington Avenue in Amherst. You can call right now at 839-1700. Stop all the pain with your dentures. Get that taken care of in a lot shorter time than you think. And truly have the best smile in your holiday picture. Why not? Once again, the number is 839-1700. You'll be visiting Dr. Todd Shatkin and his wonderful staff. All righty. We'll have more when we come back. We want you to know the segment was brought to you by our friends at the Aesthetic Associates Center.